Welcome, everybody. This is the Global Health Financing session, a critically important topic. I'm so glad that we're able to cover it here, especially with these four experts who are also just innovative in their own ways and bring a ton of perspective to this topic. So it's my delight and honor to introduce Bertha Coombs, who covers healthcare and markets for CNBC. And take it away.
Thanks very much. Although I want to correct you, I'm not an expert. I am a student, really. They are the experts. To my right is Seth Berkley. He's the CEO of Gavi, which handles the Vaccine Alliance Foundation and is very much involved in that. Phyllis Costanza is to his right. She is the CEO of UBS Optimus Foundation, which does a lot of funding and helps people get involved in global health. And David Milestone, who's the acting director of USAID Center for Innovation. Thank you all. I wanted to start with a conversation I had with Dr. David Chen, who is the CEO and founder of ChenMed. We were talking about healthcare, and it was in the context of accountable care organizations. And he was saying part of the problems of the program has been that it has become a little bit like kids' soccer. He talked about how his kid would go to soccer and everybody would get a little trophy, and his kid, when he graduated to the next level of soccer, lost at a game and didn't get a trophy and wasn't quite sure why that was. He had gotten so used to just being rewarded for showing up. And he says, we've sort of made healthcare like that. And I've got to imagine in philanthropy, for a while it's been a little bit like that. Even in global health, the idea of let's go out and do something good, but not necessarily having that metric and that goal to reach for. Is that something that is changing, Seth?
Well, thank you, and we don't give trophies. We actually give anti-trophies because we're lucky. What we do is we try to vaccinate the world's kids. We work in the poorest 73 countries, 60% of the world's kids, and what we're trying to do is get every kid vaccinated. So we have a natural score. You are succeeding or you're not. Your coverage is going up or it's not. The interesting thing for us about innovative financing is we've used it in many different ways to change the game. So I'm going to give three quick examples which we can come back to. But the first is recently in the news, Ebola. And what happened was during the last Ebola outbreak, the big one, there was all of a sudden a lot of vaccines that were moving forward. One of the challenges, though, was would people stay interested? Who's going to buy these vaccines for poor African countries where outbreaks might occur? And so we put up a guarantee of $300 million to help create a market for vaccines. And then we created an innovative mechanism called an advanced purchase commitment. We don't buy unlicensed products, but we said to the manufacturer, we'll go ahead and set up a stockpile. We'll buy your product when it's licensed, but for that deal, you have to go ahead and get your vaccine moving forward into the regulatory agency, and you have to create 300,000 doses, which you have to keep ready to go in case there's another outbreak in this interim period, and of course that's what happened. So an example of how to use innovative financing to do that. Second example is the pneumonia vaccine. Largest killer of children is pneumonia. And one of the challenges, we had a great vaccine in the US. It didn't cover developing country strains. And so what we did is we created an incentive, an advanced market commitment, where we said to manufacturers, if you come forward with a vaccine that works in the developing world, what we will do is pay you a top-up on every single dose. And we'll also, over the long run, buy your doses. To agree with that, you have to drop your price down to a level that is low, a tail price, and that allows countries to say, oh yes, I can afford this vaccine over the long term. And that's 95% lower price than in the US and Europe. So another way to kind of leverage this, and we took this vaccine to 58 countries in the course of 5 years. Third example, and perhaps the most interesting, is a thing called IFM, where countries, wealthy countries, would guarantee over 20 or 30 years payments per year, and it's legal guarantee. And with that, we can go to the capital markets and be able to float bonds. And with those bonds, we can move money around in time. We can front load it, bring all the money up front, or we can move it later in time. And that allows you to have flexibility to be able to finance programs. And we're now this is being looked at to be used in other areas. This was a $6 billion financing effort we did. So very important to the type of work we're doing, and we can talk about it going forward.
And Phyllis, I have to imagine when you're dealing with wealthy people who have had the good fortune to accumulate a lot of wealth, they want to have the same kind of impact in business when they do giving.
Yeah, absolutely. So first of all, thank you for coming to this session, everybody. Somebody who shall remain nameless said to me when I said we're talking on financing, he said, that's going to be a huge dork fest. So I'm really glad to see.
I would never.
I'm really glad to see that there are so many very interesting non-dorky looking people.
I resemble that remark, and I have no problem with that.
Excellent. But you're absolutely right. So what UBS Optimist Foundation does is we help our clients, and UBS is the largest wealth manager, with their philanthropy. And what we've seen is that 80% of our clients who are engaged in philanthropy, which is almost all of them, are not satisfied with the impact they're making. So there is a huge market out there to help wealthy people with their philanthropy in ways that make it a lot more transparent, and also help to work with the organizations on the ground to improve the quality of what's happening. So do people out there know what a social impact bond is? I'm going to do a 30-second 101 on that. Yes, there are some people, okay. But most of you don't, further proving you are not dorks,
Well,
indeed.
I was just going to say it clearly. If you in the crowd.
So social impact bonds started in the UK with a prison, and the goal was to keep people out of jail. However, the way government budgets work, as you all know, is governments don't pay for prevention for the most part. We pay only if somebody falls off the cliff. But we're not going to put a fence up at that cliff. We're just going to pay for the ambulances. So in the UK, it costs roughly, these numbers aren't right, but £50,000 to keep a prisoner in jail. But a nonprofit can reduce recidivism rates at a cost of approximately £25,000 per prisoner. That's half the price. But the government budgets don't allow them to fund the prevention work. So a group of investors, philanthropists, foundations came together and said, we're going to give you, nonprofit, the money you need to do to perform your job, which is to reduce recidivism rates. They set really clear targets around that. And the government then said, we'll have a robust evaluation. The government will pay back the investors who invested £25,000 per person. We'll pay you back £30,000 every time you prevent somebody from going back to jail. So the government saves £20,000. The investors make £5,000 on their £25,000 initial investment, and the nonprofit has the money it needs to do its good work. So that's a win-win-win-win. There's a lot of wins in there. How do we take that to development then, to global health, to all of these key issues that are plaguing our societies? Well, we've got a huge gap to reach the Sustainable Development Goals of trillions of dollars. We know that government international aid funding hasn't risen since 2010. It's stayed relatively stable at about 1.8% since then. Yet, private philanthropy, domestic resources have been going up a lot. We see number of billionaires has grown by 12% this year. So how do we use that private sector money to catalyze large-scale change and really create a marketplace to pay for outcomes? And that brings us then to a development impact bond, which is where private investors will pay to achieve very specific outcomes, and somebody who doesn't want to take any risk, whether it's a government or another foundation who wants to take no risk, will pay back the private investors with a return. Because after all, they're not taking any risk, and they should have to pay for not taking any risk. And that's called a development impact bond. And that's something, while not a silver bullet, is a way to help bring back trust to private philanthropists because it makes the system completely transparent. You only pay if you deliver outcomes.
But the thing that occurs to me is it's wonderful, and that one might argue it's great because there's been such a transfer of wealth, sometimes because of policy, that has helped some of these people accumulate the uber-sized wealth that they have. But now you get an onus and a bonus. I'm glad that they want to do well, and there's an onus on them to do it, but if I am in need of a project, if I don't happen to fall within their scope of interest, whereas a government has to look at all of the scopes of interest. Terrific that Bill Gates is looking at malaria and looking at vaccines, but he might not be interested in colorectal cancer. I'm sure he is, but that there are going to be gaps in areas that, as governments pull back and individuals pull in, might lose out. So how do you, with a governmental agency, try to help get some of those less sexy projects the kind of attention that they need?
Well, so just to set the record straight, I had actually said that this was likely going to be the most enlightened, caring, kind crowd. I don't know where you got that other stuff from, but I'm from the U.S. Agency for International Development. This is an organization that's part of the State Department that since the for decades has been doing sort of traditional development assistance, and we have, along with other partners, been a big portion of funding what needs to be done in the low middle income countries around achieving this great progress that we've had in global health. But we still have some really ambitious sustainable development goals to reach. And as Phyllis said, our funding has really sort of flatlined through multiple administrations. And our percentage, the percentage of what we're contributing through donor assistance for health is becoming a smaller and smaller part of what's needed. And so no longer can a place like USAID just write sort of checks in the traditional way that we've been doing business. We much more need to be thinking creatively about how we can catalyze and crowd in new sources of funding. So for example, these markets in Africa and Southeast Asia are some of the fastest growing healthcare markets in the world. And so we're beginning to see interest from medtech and pharma companies in co-investing in initiatives there. Talked about the rapid rise in private wealth. We need to do a better job of partnering with these non-traditional actors in global health and coming up with creative solutions. And so we, as a center at USAID and the Global Health Bureau, have begun to brought in different perspectives in how we work. And so we have a team full of MBAs like Nikki Tyler here, who have worked in finance or strategy in medtech, pharma, or on Wall Street, and bring in that kind of thinking in how we can better unlock some of this private capital. And so, for example, we've done things like an advanced purchase commitment to de-risk investment in Zika diagnostic tools so that we can crowd in some new solutions there. We've done things like a development impact bond, which Phyllis just described in Rajasthan, India, where we, USAID, along with Merck for Mothers, are the outcome funders. And so we will only pay Phyllis's private investors back if the implementing partners in Rajasthan, India, are able to achieve certain measurable outcomes or outputs in this case, in upskilling and upgrading 440 private maternity clinics throughout Rajasthan, India. And that has been a great way for us to make sure that we're using our funding. In this case, it happens to be, I think, $4 million, which is coming from USAID, to leverage all sorts of other funding, and really reduces the risk for us and aligns incentives for our partners to make sure that we're focused on results and only paying when things work. And already, even though that's for USAID a relatively small project, has catalyzed a ton of interest in this new approach, which I think can address your question of both sort of the soccer analogy, we're focused on results, not just showing up, but also can address many other health areas. So for example, we're in talks now with the UN around analyzing the potential for a development impact bond to eliminate cholera in Haiti, and also working with the Global Fund and our PMI team, the President's Malaria Initiative, to look at how we can use wealthy individuals in Africa, for example, to de-risk investments that we need to eliminate malaria there. So we're just at the tip of the iceberg, and there's a ton of potential.
But you're not answering my question about how do you how do you get their interest in things that may not be getting covered and may not be as sexy and may not necessarily have that immediate sense of, here, we've achieved our metrics so that you can feel good about it, 12 months from now.
So, but most healthcare is done by countries. That's where most of the expense occurs. So when we come from outside, we provide additionality, we provide technical assistance, we bring new tools, and the whole idea of public-private partnerships is to bring in the different sectors and have them target problems that are there, bringing whatever they can bring to the equation. And more, not only is this being done at banks and government agencies and a public-private partnership, but one of the challenges is how to get countries to rethink their problems. So if I used your example of colon cancer, in many of the developing countries we have, that's not a problem at all. They don't even have that cancer because of the diets or because of the age that people are dying at. That may not be seen as their major problem, but others are major problems. And then the challenge is how do they target them when they're outside of the traditional ways that development agencies work? And that's where you have to have strange bedfellows, strange partners, and bringing together these new mechanisms and incentives to be able to drive forward a new partnership for development. And I think that's what's really exciting now, because you've heard what's, in a sense, the same from all of us are new ways to use new tools in an area that traditionally had been write a check, or charity, and that's not good enough anymore.
Yeah, so the private sector is this strange bedfellow that Seth mentioned, and you asked a good question about individuals and how do you get them to, or how do you have a big enough portfolio so that there's something for everybody? We never will, is the truth. But we know of our clients who are interested in philanthropy. Again, that's the vast majority of them. Most of them are working in the area of children and children's health and education and increasingly child trafficking. So we don't capture them, but what's more important is people will come to us, oftentimes clients, and say, I'm a doctor and I want to start an organization that's going to lead medical missions to Africa, and we're going to take the best surgeons from America and Europe, and we're going to fly to Africa, and we're going to perform surgeries, and then we're going to come home. And we all know these organizations, and so what my job is to say, don't do that. Do not. Stop right there. You're wasting precious money. The opportunity cost of this is extraordinary. And for the amount of money it takes to fly somebody to Africa from here, we could be building local capacity to do this work, which is critical. So we need to educate people. And if you look at America, 96% of our philanthropy stays here. Why does only 4% go overseas? Well, for a lot of reasons, but one of them is people don't trust it. So if we can start to get people to trust the important global health issues, as we saw, with things like Ebola that affect us right here, if we start to make this more transparent and get people to trust the system, hopefully at some point there'll be an opportunity for everybody to do it in a really transparent way.
So what did you tell those folks to do? Did you tell them to look at Médecins Sans Frontières or Partners in Health, or?
So no, well, actually, I'll use surgery as an example. So it's one of the most underfunded areas. 17 million people die every single year for lack of access to safe surgery. 5 billion people don't have access to surgical care. So in this case, UBS has about $2 trillion of assets under management. Look at these other large financial institutions have trillions of dollars. We have the power to actually change that. So we should be proactively going to our clients and saying, hey, look, you really want to move the dial on a global health issue? Let's focus on something that is not being covered. Let's try to bring billions of dollars to solve issues around global health, whether it's safe surgery or the important work that Gavi is doing around vaccinations.
And just to close the loop on your question that I didn't answer the first time, USAID is funded from Congress via sort of earmarks. So our approximately $3 billion a year in assistance is tied to things like maternal child health, malaria, those types of things. We haven't moved into NCDs, and so I think that's why it's so important that other partners do step up and fill some of those gaps.
But I mean, there are common, if we use, for example, the combination of these issues, a major problem is cancer in the developing world. And so not colon cancer in many countries, but for example, cervical cancer is the single largest cancer killer of women. The diagnosis in the developing world is made by smell. It's horrible. A woman comes in, rotting out from the inside in end-stage disease. She dies a slow, horrible, painful death, leaving a family behind. You know, we have vaccines.
I was going to say, the HPV vaccine.
We have a vaccine that can prevent all of that, but even if we get that to every woman, and that's our goal, is to try to do that, and we're in the process of scaling up, that means that the generations of older are not going to be protected. So one of the questions then is, can we do screening and basic treatment? And again, there are technologies to be able to do that now. So these are areas that are being ignored that can make a difference. And to Phyllis's point, the way you do that is not get an obstetrician gynecologist from the United States to go and do pelvic exams in some place that's socially inappropriate, that, you know, doesn't speak the language and have the knowledge. It's capacity, building capacity in country, making sure they have the tools and the training to be able to do that.
How do you, I was very interested in one of the scholars was talking about that, and she was saying, you know, I hear from all these people who want to bring their new NGO and solve the problem in Detroit. She goes, that's not what we need. We have people here who know what's going on. Come help them and listen to what they are telling you that we need. Are the people on the ground able to, you know, come in Shark Tank and say, look, here's my program that I need funded? And are these donors receptive to meeting with them and hearing from them and really getting involved?
As you can
Is
imagine,
it a Shark Tank situation?
It's a mixed question. I mean, sometimes there are great ideas just waiting for funds. Sometimes there are great ideas waiting for funds, but they need a lot of technical assistance to get there. And sometimes there are bad ideas that are looking for funds that probably shouldn't get funded.
And there are bad ideas that have really great fundraisers who are getting tons of funds.
Right.
Which is the biggest problem.
Right. And so how do you help these donors sift through that?
Well, there's no marketplace. We don't apply similar rules in our sector as we do in the business sector. In the business sector, I'm not advocating that everything we do in the business sector should be applied. That's absolutely, hopefully, will never happen. But there are things where there are times when we can evaluate outcomes. You know, if you look in the U.S. alone right now, about $800 billion is spent on human service programs in the U.S. And do you know how much of it we know actually works? What percent of that $800 billion do we have knowledge of impact of? Does anybody have a guess?
27%.
That was a really good guess, but it's 1%. It is 1%, okay? So let's now take this overseas. How much of it do we, what percent of the philanthropic money going to international health do we know is making an impact? Does anybody know?
2/10?
Actually, I don't know. I don't know.
No, the answer is it's higher because very few philanthropists are doing overseas, and the ones that are some of the big ones who are metrically driven.
So it's proportional, yeah.
Yes.
Well, yes and no. I think the point is we're making assumptions. We have no idea. I don't know what percent of programs work because we're not measuring it. We haven't really created a transparent marketplace. So one thought is, how do we let people in the private sector actually buy outcomes in a really transparent way? So, you know, we don't have to do research. We don't need a complicated RCT to say that the HPV vaccine works. We know it works. But let's pay them to get per vaccine. You know, let's create this market where people can buy these outcomes, which is getting vaccines to the most underserved communities. And if we could create a marketplace, you know, in the financial markets. Why not create an asset class where you're paying for outcomes and somebody else might be reimbursing in some way?
Yeah, but sometimes paying for outcomes, again, produces perverse incentives and unintended consequences.
Indeed.
For example, when you look at patient advocacy groups, they sound great, right? Interesting that they're often funded by the people who are going to benefit from that advocacy. So I have a drug and I am going to benefit from that, so I'm going to pay your premium so you can get an ACA plan, so I get reimbursed more for that drug or for that dialysis than I would if you were on Medicaid.
And that's a conflict of interest. And we don't know this because there's no transparency.
But there is, I mean, some of the new institutions. So, you know, the U.S. made a decision that the U.S. funds a lot of programs bilaterally. They made a decision that for vaccination, they would work through Gavi because we're transparent,
Right.
because we have good conflict of interest policies. And the advantage they get, which is interesting, is that if the U.S., as big as it is, wanted to negotiate with companies, they couldn't negotiate the same way we can because we're buying vaccines for 60% of the world's kids. They might, buy for 20 or 30 or 10, and so by bringing together and creating a marketplace, you can get both transparency and outcome measures, but also create efficiency. And the challenge in the past has been you had all of these small independent things trying to do things, non-transparent, not knowing outcomes, and I think we need to really change that into something that is much more able to be measured and seen.
Yeah, and just to add this idea around how do we make sure that private philanthropists are putting their money in the most efficient and effective programs. I think one example that is, I think, going to be the wave of the future is the Aspen Management Partnership for Health, which basically embeds leadership and management capacity within ministries of health, supports them on their mission and vision, and then unearths different ways that private philanthropists, for example, donors like USAID, can help support that vision. So it really starts with the country first. And I think that a program like the Aspen Management Partnership for Health is a great one that really raises visibility to the priorities that countries have and make sure that we're connecting funding with the places that will have the most and programs that will have the most impact.
Yeah, from private philanthropists, the phrase that I love to hear is, I have billions of dollars and I want to create social justice. I want to put it towards something really important. That's that's music to my ears. Conversely, then they say, and I have a great idea on how to do it.
Well, you got to figure, right, if they've climbed the ladder and have been leaders.
Exactly.
Yes,
Right.
but the ladder's not necessarily the same ladder, and that's
It's not
the
the
challenge.
same ladder,
Yes,
but
exactly.
I'm going to open it up for questions. I know a lot of you do. After this one last question, you talk about these bonds and for the sustainability of the funding. Obviously, there needs to be reinvestment and paying back. What's the failure rate on the bonds? Are there any that have defaulted that haven't been paid back yet, or is this just too new to really assess that?
Are you asking me about social
Either,
impact bonds?
yeah.
Okay, I can explain on social impact bonds. So I would actually, it's not technically a bond, it's just called a bond. That's a whole nother story, but it's, Goldman Sachs funded a recidivism program in the US in Rikers Island, and turned out that after the first year, they saw that the nonprofit organization wasn't actually delivering the targeted outcome. So they stopped the bond, and everybody said, oh, it's a failure. No, it worked perfectly. It actually did exactly what it was supposed to do, which was stop paying once the outcomes weren't being delivered. On the development impact bonds in developing countries, frankly, they're too new right now to give you any meaningful data. Our first one, which was in education, we'll announce the results. It was a 3-year program. We'll announce the results in 2 weeks, and without spoiler alert, they're good.
And it's interesting, on our bonds, they were very smartly set up. Gordon Brown, when he was Chancellor of the Exchequer, before he was Prime Minister, kind of did the infrastructure for it. He made them legally binding. And so during the financial crisis, a government decided it really, was not interested and maybe it would default on it. We probably could have managed in the overall ecosystem to have done with that. But what happened was the rating agencies said, well, if you're going to default on this sovereign promised bond, you're going to lose your ratings. And they're like, for whatever it was, their payment was 10 million. They were like, okay, we'll pay on time. So we've not had a default. And in fact, what we've been working on now is interestingly expanding into different marketplaces. So the iridashi market in Japan, really interesting, where mothers love to go and invest their money, their investment decisions. I get a good return, but I do good. Or sukuk bonds in the Islamic world, where they have special regulations. And again, we did the largest social bond in a sukuk marketplace, and it was great because it brought all kinds of visibility to immunization, which is important in those communities. So there's a way to engage with the financial sector to really do interesting advocacy work in addition to good investments.
And just to give perspective, this development impact bond in Rajasthan is the first development impact bond in health ever. So when I said tip of the iceberg, it's the tippy top.
Terrific. Now, I see people are chomping at the bit. I just want to remind you to wait till you're handed the mic so that everyone can hear. The woman in the pretty flowered dress.
Hello, my name is Ella Entwitaisest. I'm from London. I'm the co-founder of IPD Healthcare, and we want to use early cancer detection for underserved women in sub-Saharan Africa using mobile mammography. You talk about DIP, development impact bonds, and like you said, there's not many in the world. There's very few in the developing world. What are you doing, you and your partners in the ecosystem, doing to accelerate more DIPs in developing world?
Well, many folks will use this terminology, we need to go from retail to wholesale in development impact bonds. They are today very expensive and time consuming to set up because you have to agree on what you're going to measure, what you're going to pay in advance. And at USAID, we spent 3 years, Joe Wilson, who's in the crowd, actually worked on it from our end, 3 years getting the paperwork through. So we need some evidence that these work. I think there's also a communications campaign that could be undertaken. So for a lot of folks, innovative financing, development impact bonds, it's gobbledygook, and it sounds more complicated than it is. And so I think we need to do a better job of showing how these can be more cost-effective ways to get greater value for money, but also improve health outcomes. And so I think it's something that we can do better together, which is sort of better defining and collecting data, and more importantly, making the case for these when they're appropriate.
And let's go over here, the young man in the plaid shirt. I think we have one on the other side. Oh, we only have one mic. Can we pass it down, perhaps, fire brigade style? Thank you.
Yeah, thank you very much. I'm Brian from Uganda, and I'm Aspen New Voices Fellow. Thinking about sustainability, for example, the Gavi co-financing model, which makes government actually try to improve their domestic financing. How would you use these bonds to entice governments to invest more in health? Because there are issues around governments and the way they prioritize expenses and not giving so much attention to health. So I appreciate the Gavi model and how it has tried to bring governments to up their game in terms of spending on health. How would you use the impact bonds? Because the governments are the receiving entity to make sure that they increase their domestic financing into health.
Should I take that, I assume? So what we've done so far is, before we go into a country with a development impact bond, we will negotiate with the government, have conversations, we sign an MOU. I understand that's not legally binding, but they have a stake in the outcome because the economic impact of these initiatives are substantial. So for instance, in Rajasthan, we're not just going in there without lengthy negotiations and discussions with the Rajasthan government. And the objective there is that ultimately they'll be the outcome payer. And then you don't even need the middleman anymore. Ultimately, the Rajasthan government will have such strong demonstrable impact that they'll cover it. That's not going to work all the time, and I acknowledge that. And the only way to scale and make things sustainable are by, from a financing perspective, is if government pays for it or if the private sector pays for it. So those are the only exit clauses here.
Let me just, sorry.
Go ahead.
Well, I was just going to, because not everybody understands what he started the question with the Gavi model. The idea that we had was, if you're very, very poor, because these vaccines are very expensive, countries can't afford them, but if you're very, very poor, you pay something. And the purpose of that is it's not even a substantial amount of money. The challenge is to get the Minister of Health to talk to the Minister of Finance, put it on the agenda, have a discussion, get a line item, and then as the country gets wealthier to pay more and more until eventually they get to a point where they transition out of Gavi support and the budget line is covering the vaccines for the kids. And we believe sustainability is absolutely critical, and therefore we believe you should engineer it into the program, because otherwise, even if vaccines are the most cost-effective intervention, you can see the countries get wealthier and you stop funding and they're like, oh, well, we don't have a line item for that, so we'll just stop doing it. And that's what we don't want to have happen. Sorry.
Yeah, I think we also need to be speaking with and in the same language of the Ministry of Finance as well. So sister organization to AMP Health is called the Financing Alliance for Health, and a couple years ago they released a report that showed a 10-to-1 economic return on investment in community health workers. This takes into account things like lives saved, of course, but it also takes into account productivity gains, GDP growth, and so to start speaking in the language of the Ministry of Finance so that they can see that this is actually not just the right thing to do, it's actually good for the economy overall. So we need to be working with the financing community and talking in that language more.
And there's a woman over here. Sorry to keep crisscrossing on either side. This is a wonderfully helpful crowd.
Hi, I'm Ritika from Washington, D.C. I have a question around the outcomes. So just an example, the Hpv vaccine, right? If there's a bond around it, the health worker or the NGO is going around giving it. How do you measure the outcome? The cervical cancer is not going to come in, within a 1 or 2 year. It requires monitoring over time. So how do you see the return for such kind of interventions where you just can't see the impact immediately or within 2 or 3 years and make a decision if that investment is worth it?
Well, if you think about, let's use HPV. If you think about the kind of the supply chain for this, first you've got to identify the people who don't have it, you've got to get the vaccine to them, and then years later we see the outcome. We know there's already data out there that shows that the HPV vaccine prevents cervical cancer. We don't have to reinvent the wheel. So in that case, we could actually just measure the number of people who got the vaccination. So we need to keep these really simple, but the development impact bond can only be used for things that have a short-term outcome. And an outcome could be used, an output, for instance, could be used as an outcome. So access to the vaccines or giving the vaccines is an output. But we know that that leads to a positive outcome. So it's not for instance, long-term advocacy work. That is not going to be dippable.
So how do you do something like that is more long-term? Or conversely, how do you do something where it's not necessarily about teaching someone to fish, but they need the fish today? You have a horrible earthquake in Haiti and you have a cholera emergency. That's not something that you can really do through a bond, can you?
I mean, the whole point is to have multiple different financing mechanisms. This isn't going to solve every problem, and our model's not going to solve any problem. There's a big outbreak and there's cholera. I have a cholera stockpile that is instantly available and made free of charge if it's a poor country, or made available and then they have to pay back if it's a wealthier country afterwards. And so, that problem has a different mechanism of solution. And by the way, just to be geeky, since we were accused of being geeky crowd.
No, it was
Dorky,
Dorky,
please.
sorry. But you heard a financing solution. The interesting thing about HPV vaccine, it's such a marvelous invention, is that you actually could do a survey in that population, and within a year or two, you see the virus disappear, and it starts having an effect in that population, which you can actually measure. So you don't have to wait until you have cervical cancer, because first you see virus disappear, and then you later on see precancerous lesions disappear, and eventually you see cancers go away. So, and that's the data that's being seen now in Australia, in other countries, Rwanda, which started this early. We're beginning to see this amazing data to show the power of it, as an intermediate measure before you get to the final one.
And I'm going to make it go way to the back. For the woman
Keep
in the visor.
running.
I know. Well, I think I want to cover a wide geographic area.
Do folks
am I
remember
missing
Phil
people over here? 'Cause I
Donahue?
keep
Is that
looking over there?
Yeah, that guy
Hi,
did.
thank
All
you.
right.
Constance Shulquist from Health. Does this model, this might be a really naive question, but does this model apply to the U.S. itself? So for instance, could you put up the same type of model whereby there are philanthropists who would either go at the government level, the U.S. level, or at a city, community, state level to really put together a way to pay for healthcare or get ahead of healthcare rather than just hoping that the government and our taxes figure it out?
Are you talking about social impact bonds specifically, or advanced market commitments?
Advanced market commitments. So having philanthropists, right, investors. I mean, most of our investment today in the U.S. is tied to startups, right, that have cool technologies or evidence-based research. But could you do more of the sort of, the preventative models of community opportunity where philanthropists who have skin in the game of either a given social determinant or a diverse population, and really put together the funding mechanism for a philanthropist to get together around that type of cause? And other than things like Robert Wood Foundation and others that are big players, is there more of a sort of systemic model that the U.S. could play with?
I mean, so if I go to the advanced market commitment, there's lots of interesting discussions on how one could do this. An example of a big problem we have right now is antimicrobial resistance. So there's a big push to say, gee, we need to get companies to make more antibiotics, and of course that's important. That doesn't really solve the problem, because if the antibiotics are used, then you'll get resistance to those, because it's an evolutionary certainty. So one question is, could you create antibiotics that could only be used in the case of a severe infection underwritten by an infectious disease specialist, et cetera? Well, no company is going to be interested in doing that, because
Well, some of them are, actually.
well, no, but they're not going to be interested in the way I'm describing it, because if you create an antibiotic that intentionally never gets used or gets used only a couple of times, you can't make any money. So people have described one way to solve that is to give a prize, give the company $1.5 billion or something. Well, politically that's going to be a hard thing to do. But another way is to create an advanced market commitment and say, for each time this dose is used, you'll charge $1,000 for the antibiotic, but you'll give another $50,000 top-up payment that will go back to the shareholders to allow this to be, so you can use these mechanisms creatively to try to solve problems.
Oh, gentleman over here.
Hi, thank you so much for such an enlightening conversation. I'm Mohammed Sabir. I'm a 2080 fellow, New Voices, and I'm founder of Islamabad. So we work with Gypsy and nomads in Pakistan. So my question is very simple. How can we tap these funding opportunities to like my organization, which is working the very vulnerable and like deserving community, which is still out of the reach of these development opportunities? And like many of my sub-Saharan, like African fellows, like mostly we are working in the real ground, and we are like really struggling with it, and the community we are working, they are looking up at us, and we don't know which door to knock, and we are trying to reach you guys. So how you can work with the small players on the ground who are serving the real people and with much larger impact?
So basically, smaller players who aren't necessarily within an infrastructure that is going to allow them to get access to.
Yeah, it's a great question. First of all, these are expensive to build. So we need to try to reduce the transaction cost. So doing a small development impact bond is not going to be cost effective. So what we're trying to build now is a fund where it's built just like a private equity fund is built, where you've got a number of different implementing organizations in this population. They're all striving for very similar outcomes. They can't be dramatically different because that will increase the cost. But let's say we're trying to improve access to HPV. In some of the most remote populations. And we have a number of different implementing partners who are doing that. So number one, already you diversify your risk just like you would in a fund, a financial fund. And then you also could get a diversification in the investors and in the outcome players. So for a small organization, the only way, I would say, to access this kind of vehicle is to join in with another organization. But it's also not, this is not the solution for every nonprofit. It's very risky. Because if you don't deliver on these outcomes, then you can't hide. Everybody will know about it. The funding will stop. And you know, it will have a substantial reputational impact on the organization.
But that's, is that depending on how they fail? I mean, not to say that people should get a trophy.
No, it's
but you know,
excellent,
there's a lot to be learned from failure. Isn't
yes.
there?
Oh, this is so the beauty of these is that the implementing organizations, whereas I'm sorry to criticize USAID, but the traditional funding model from large bilateral donors is we're going to pay you $10 million and you've got to deliver these activities. Reach out to this many people, hold this many trainings, and you've got no flexibility to modify that. I don't care what you do. I care about whether or not you've saved lives. And if you find that something's not working, then go ahead, change it. I'm not measuring you on these outputs that don't matter.
And Seth, I would imagine you work with them to help make something that could be more successful.
Well, I mean, it's interesting. So we work with small civil society in Pakistan and in countries around the world. One of the challenges, though, is that because we get government money, we do have to have a certain level of financial assurance. And that becomes a really important issue for small institutions that may not have, you know, as good accounting principles or financial systems set up, et cetera. So even we're limited, we're more flexible, but it's a problem. But again, what's really nice is you want a diversity of funding models. So now there's a whole new set of funders that are doing crowd-based financing of small NGOs that are, you know, targeted, where you can put up your mission, what you want to do, how it's going to be done, what your systems are, and then people can join and finance that. And so I think, again, the critical issue is it isn't just going to be the big models with the social impact funds of the governments, but how we create an ecosystem of funding streams to allow multiple different activities to go together. And of course, the beauty of that is then if a small NGO is successful and delivers, and it begins to then, you know, do more and show more, they build stronger systems. Eventually, then I can fund them, or if I build that up, then eventually USAID, you know, so it becomes part of building that ecosystem.
So David, given that they keep beating up on you, I'm going to let
used
you
to
have
it.
the last word in our last couple of minutes here.
No, I mean, I will say, you know, so the development impact bond isn't the silver bullet, as Phyllis said. You know, USAID has also been doing a lot of work in development credit, in DCAs, so Development Credit Authority. So they will be guaranteeing up to 50% of a given loan. So for example, in India, a primary health system called HealthSpring needed money to expand from 10 to 100 facilities in India. USAID came in and guaranteed 50% of that loan. So they were able to access banks and financing that they wouldn't have otherwise been able to finance, because, you know, primary care in India is not a huge moneymaker. And so in that way, we are starting to work in different ways. And for that amount of funding, actually to implement it, it only cost USAID $50,000.
Terrific. I guess we're going to leave it at that note. Thank you all for sharing your insight on this very important topic. I've learned a lot myself, and if someday I have tremendous wealth and hit the lotto, I will certainly be hitting you up, Phyllis.
Thank you.
To make an impact. And thank you all for your wonderful questions.
Thank you.